Signs. We're focusing in now, and joining us is Dr. Demetrius Lopes, neurosurgeon and national spokesperson for the American Heart Association and the American Stroke Association. Dr. Lopes, thanks for joining us.
Thank you for having me.
First of all, we talked about strokes taking place and many people not knowing the warning signs of stroke. So what are the warning signs of strokes?
The Together to End Stroke initiative with the American Stroke Association and Covidien, which is a global healthcare product leader, are teaching us the acronym FAST. So if you have a facial weakness, arm weakness, speech difficulties, either by the inability to communicate or to understand, those are the most important warning signs for one to go ahead and call 911, which will be the time from FAST, the T from FAST. So identify face, arm, and speech changes. That will be the key part to make a huge difference on preventing patients or folks who have strokes.
So FAST is the acronym that we should all keep in mind if we're experiencing any of the problems that you talked about.
We need to be aware first of what are the warning signs, specifically if you care for folks that have a high blood pressure, diabetes, obesity, or smokers. These are risk factors that if you know that a warning sign is developing, you can then call 911 and get that loved one to care before a major stroke happens.
You talked about some of the risk factors, but who is most at risk? Is it the elderly or the young? Who's most at risk for having a stroke?
No, a stroke doesn't discriminate. A stroke will get any race, any age, and will catch you at any time. So potentially these warning signs have to be watched almost every time. So the best thing is to be aware if a change like this happens in a very healthy person. It could be a child or could be an elderly. You have to be able to then just that light bulb goes on and you call 911, because you never can take for granted those signs.
Now, tomorrow is World Stroke Day, and what are you hoping that people will do tomorrow?
I think that the best thing they can do is to go to the American Stroke Association website and get knowledge and learn about how to identify the signs. Hopefully you can download this app to your phone. I think that this is an important time for us to make a difference in our future. It's predicted that by 2030 we're going to have a significant increase of strokes happening on the age of 40 to 65. We have to make a difference by learning and educating ourselves, specifically in this moment of the World Stroke Day.
Dr. Lopes, neurosurgeon and national spokesperson for the American Heart Association and the American Stroke Association, thank you for joining us today and sharing this important information.